compulsory drugs you need to take if you discover that you are pregnant, or you've read pregnant. Please do not escape this. It's very important. Please listen to me. If you are pregnant or you're aspiring to be pregnant, number one is very important. Folic acid is number one. Folic acid, you need to start taking it even before getting pregnant, 3 months before getting pregnant, so you have enough folic acid in you. Even if you don't start when you are pregnant, it's very important, because if you don't take folic acid during pregnancy, it can cause congenital defect or congenital disorder, where you get neural tube defect. Number one of it is spinal bifida. Spinal bifida, this is where the spine and the membranes does not develop. There is incomplete development of the spine, the membrane surrounding the spinal cord. Okay, and this is very important. This is where it can complicate, where the baby will not even walk forever. If, because the treatment is just surgery. Only surgery can cure it. You can correct it with surgery. What if you don't have the money for surgery? Meanwhile, folic acid is affordable in the market. You need to start taking it very, very early. Immediately you are already pregnant, because I discovered that some women have hormonal imbalance where they don't even know that they are pregnant safe within because this brain, spinal cord, scalp, spine, they develop within 23 days, 26 days following conception. So what if you don't know that you are pregnant? That means you can have congenital disorder. The baby can have congenital disorder, bringing out a baby to suffer in this life, which is not good. That means that this is why you need to start taking it before 3 months before you get pregnant, or 3 months, because any woman that is planning to get pregnant should start taking folic acid. It is very important, and it helps in conception. And that disorder that it can cause if you don't take folic acid during pregnancy is anencephaly. Anencephaly, where there is the absence of the scalp, the brain, and the spinal cord. It's very important. See, if the baby, and this baby born with anencephaly dies within hours of birth, or there will be miscarriage. Some of them, they die, and this thing happens 1 out of 500 women, pregnant women. So you should not be one out of that 500. Please, folic acid is affordable in the market. Please consider taking it. If you check your that you've missed your period, you need to do, as number one thing you need to do is pregnancy test to check if you are pregnant. If you read pregnancy positive, please start taking it. It's very, very important. Please, very, very important to prevent bringing out a child to suffer in this life, or to bring in fact, let your 9 months suffering and everything not be in vain, because that baby will end up not surviving. And even if the baby survives, my sister, you spend more money, more than folic acid of how much. Is very, very important. Another one is vitamin B complex. It's very important to take him to supply with vitamins, because as the baby is growing inside your womb, the baby needs more nutrients, more supplements to help you with your baby. Don't say you are, maybe even the folic acid that you are eating, maybe a food that contains folates. My sister, it's very difficult to replenish or to get enough for you and your baby. And that one is iron supplements, ferrous sulfate. You and your baby needs blood. That baby needs blood to grow well. That baby needs blood to function well, and you need blood. Check when a pregnant woman is anemic. Just check out the condition. Check out the condition. Is not the prognosis is very low. It's very, very low. So you should take ferrous sulfate. Buy it. There are all these things that they are called routine drugs. Routine drugs. They are not difficult to buy. They are not even costly. And that one is calcium. You need to buy calcium for your own bones, especially if you are obese or diabetic during pregnancy, gestational diabetes. The bone softens, and the density of the bone gets low. So you need the calcium or the vitamin D. Vitamin D can still serve anyone you have, either of the two. You can buy it and start taking it for your baby and for yourself. I still remain your one and only all-round Nurse Doris. Please subscribe to my YouTube channel, my Facebook, and my TikTok.